All right, so let's start with some of the physical changes that take place starting in, let's say, midlife. Um, First, we're going to talk about some sensory changes, and we're going to start with vision first. And so, just in general, and maybe some of you have experienced this with your own parents or other adults that are in your life, that by one's 40s, we often see that it's kind of common for a person to have difficulty in reading small print. There are individual differences, of course, with this, but we see more difficulty there. And part of that comes because of the way that the eye is just physically changing. The lens of the eye is thickening, and this is combining with the weakening of muscles that enable the eye to adjust its focus or accommodate to nearby objects. And so when we go further into the lifespan, we see that in the 50s, it's quite common that the accommodative ability of the lens is just 1/6 of what it was at age 20. And in 160s, the lens loses the ability to adjust to objects at varying distances entirely. There are individual differences again, but one of the terms that they use is called just old eyes is presbyopia. We also see that for many adults in this time period, their ability to see at night or in dim light declines. And in people in this age range, they're at an increased risk for glaucoma. And that's partly because there's poor fluid drainage, and this is leading to pressure. And this could ultimately damage the optic nerve. Now, this doesn't apply to everybody. There's obviously an increased risk, but on average, they say already 2% of people over 40 are at risk for developing glaucoma. I know in my own family, I have my mom wears bifocals and has struggles to even use those glasses because it is an adjustment. But I know people who are in their 40s who started using bifocals or trifocals in order to focus on different things. Technology has come a far way in terms of our ability to see, obviously. So we're able to often take these changes in stride and just get new glasses or I mean now they have other procedures such as LASIK that you can adjust for some of these problems. But by and large, vision is just something that is changing in midlife quite substantially for many people. The next sensory change I wanted to talk about relates to hearing. The first thing is I think about my dad, and whenever I'm making a statement about hearing, he makes the dad joke of, huh? Like he just can't hear in general. And hearing problems are quite common. It is typically the case in my human development course that I have CSD majors who are interested in audiology. This is a field that is very important. So some of this information for those of you who have more knowledge on this is just the tip of the iceberg, just a summary of some of these sensory changes. But about 14% of Americans, that's a rough number. I don't need you to know that specific number, but it still is sizable between the ages of 45 to 64, so this midlife period, suffer from some hearing loss. So the equivalent to what we were just talking about with presbyopia or old eyes, we have presbycusis or old hearing. Usually the first sign of hearing problems is a decline in sensitivity to high frequency sounds. And some of you may have, let's say, grandparents who are or parents who are struggling in this way. Sometimes adults, because this happens gradually, sometimes adults aren't aware that they have hearing problems until much later, or until people are saying things to them such as like, hey, I think you have hearing problems, because this doesn't happen overnight. And so we get used to it and think that we can do more than we actually can. Some of you might have grandparents who play the TV really loud, for example, and they might not be quite aware that they're playing it as loud as they actually are. There's an interesting gender difference that men's hearing declines typically earlier than females. And if we were in class, I would ask you why you think that would be the case without giving you the answer here. But the main reasons tend to be just louder lifestyles. I think of my own husband and where he's going to be in the future. But I mean, not only is he a drummer, which doesn't apply to obviously every male, but he's always around machines. And he was just mowing the lawn a second ago, and he does wear protective earwear for that. But has he always? No. So also we just think about men in a workplace environment. I'm not saying that all men work in loud workplaces, or nor am I saying that women don't work in loud workplaces, but we do see a gender difference that workplaces tend to be noisier. Similarly, there are other pollutants, and those other pollutants are associated with men's health, and so there are important associations here. We also know that issues with high blood pressure and strokes and heart problems can have ramifications for our bodies systemically. And so based on all of these factors, men's hearing tends to decline earlier than women's. Next, we're going to switch gears and instead of talking about some sensory changes, we're going to talk about skin. One of the items on that list from the Huffington Post mentioned that adults are spending a lot of money on skincare products. And one of the reasons why adults are spending more money on skincare problems is because they're trying to prevent or counteract these normal signs of aging. Just age spots, for example. We'll talk more about that in just a second. There's a story that's brought to mind though. I remember one time going to see my friend perform in a dance recital, and I was sitting next to her grandma. Now her grandma was probably in her late 60s, so still out of this age range. But at some point, grandma got her arm kind of caught on the seat chair, and it kind of ripped her skin a little bit. And instead of just leaving a scratch behind because of the condition of her skin. And perhaps this was because, in part, because of medication that she took, but part of it is just because of changes in skin consistency. It actually caused quite a big injury on her arm from just a simple little scratch. And I'll never forget that because it was pretty dramatic. I won't go into more details here. By and large, as we age, the skin becomes wrinkled, it loosens, it feels dry. The reason that these things happen is there are changes that are happening in the levels of the layers of the skin, the epidermis, the dermis, and the hypodermis. And so ultimately that's affecting the skin's consistency. This is something that it's almost like you can't really fight it. We do know that people who are in good health and who are avoiding the sun and who stay hydrated, these are protective factors, but nevertheless skin is going to change with as we get older. That's why it's always so interesting to see people who are in the media or who are, celebrities, and their skin consistency doesn't seem to look like how they, the age or represent the age that they really are. But that's because they're having expensive procedures or plastic surgery done in order to maintain that youthful appearance that is this, highly valued but among celebrities. Already in the 30s, we start to see lines in the forehead, just creases. I know that I see those in my own face. In the 40s, we start to see, and this is on average, right? So there are some people who start this earlier, some people who start this later. 40s, we start to see crow's feet. So the crow's feet are depicted in that second or the middle picture. So wrinkles around the eye that are kind of spread out to be kind of like a crow's foot. We start to see again also in the 40s where skin is starting to lose elasticity and be more saggy. People tend to report this in their face, like looking at their jowls or their lower cheeks, or maybe underneath their eye skin seems to sag a little bit, or commonly in the arms. This isn't necessarily just about people who have lost a significant amount of weight, because we also see skin changes during those times too, but this is merely because of getting older. In one's 50s is when we start to see, again, this is not for everybody, but more of these age spots, which are just pigment under the skin. That third picture is showing a hand with many age spots. Um, and so you see that in this time period of midlife, there's a lot of change that's going on. And as I mentioned, I just want to be super clear that most of these changes, there isn't a miracle drug for it, or a miracle procedure, at least not that doesn't come with a steep price tag, because these are just normal body changes. Are there individual differences? Yes. Are there genetic differences? Of course. Some people are literally just born with skin that looks more youthful. But the protective factors that are commonly noted are the avoidance of the sun, or using protective sun care products earlier in one's lifespan, and then also really staying hydrated. These tend to be good protective factors, but not totally preventative.